Can you retire now, or do you need to still work for your group health benefits? Stay tuned. Let me talk about it. I am Sylvia Gordon with the Medicare Family, and a question we get every single week is, I really kind of want to retire. How much will it cost? That's the easy part. The question is, are you still married? Is there somebody else on your group plan that's younger, a younger spouse or partner? That's the real money. Because, like, I have an appointment tomorrow, and he's 65, she's 63. So give her a quote for her Affordable Care Act plan, and it's like $600 a month or more for an outrageously high deductible. And if she stays on her group plan, it's only $181 a month. So I said, hey, I don't know how much you hate your job or hate your boss, or, you know, what your consideration as a work is, but if it comes down to money, if you could just work 2 more years, she can have really good health insurance for 2 more years. You have good health insurance for 2 more years, and there's no detriment, there's no penalty for continuing to work past 65. You'll have all your federal rights when you do get ready to retire in 2 years, and then she can go on Medicare also. So it's not just you. Look whoever's on your group health plan with you. Now let's say it's just you, or your spouse is older, and you've been working and you would like to retire and you want to try to figure out how the money's going to work. A lot of people assume, since their employer's paying some or all of their retiree or their employer group health plan, that it's better, okay? And a lot of times it's just because you haven't checked it. And so you assume it's great. And then when you actually sit down with an agent and we compare it for you, we're like, that's not very good. Very high deductibles, very high copays, very limited network, high co-insurance, a lot more restrictions and limitations than you would have on Medicare with a supplemental plan. So most people, it used to be, except for, you know, like a handful of the nation's largest employers, it used to be everybody was so happy when they got to go off of their employer group plan and go into Medicare, because they were shocked how rich Medicare actually is. And they were very excited about it. And that was always great to be like, you know, have your client be all excited. The one thing that most people aren't as excited about, and it used to be, and it's less so every day, is the drug benefit. Often their drug benefits were slightly better on their employer group plan. And it used to be that most had dental and vision benefits at work, and they were kind of shocked and disappointed when they find out that that's not a standard part of original Medicare or most supplemental plans. That was a supplement to a supplemental plan. So in general, people are really happy when they get ready to go off their group plan. They get better insurance at a lower cost, except for the dental and vision, and sometimes except for the drugs, but that's leveled out in the last couple of years. If you are getting ready to retire, give us a call, email us here at the Medicare Family, and we can do the math over the phone with you and help steer you whichever direction you need to go. Sometimes we're going to say, hey, could you sneak out another year working, or year or 2? And if you absolutely say no, we can give you a couple options to try to bridge that underage spouse up to the Medicare age. Thanks for watching. If you don't subscribe, consider hitting the red button to subscribe. We do a video every Wednesday. Thanks.